Imagine this. It's early morning. You swing your legs out of bed, place your feet on the floor, and there it is again. That tight pull in the knees, that dull pressure in the lower back, that slow, heavy stiffness that makes the first few steps feel harder than they should. If you're over 50, you know this feeling all too well. But what if I told you there is a simple, gentle 5-minute move that experts studying age-related mobility have been recommending for years? A move so basic that many people underestimate it, but so effective that researchers and clinicians from large American universities include versions of it in senior mobility programs. This technique isn't a trend, and it isn't based on guesswork. It's rooted in decades of understanding how aging affects the joints, nerves, and muscles. Specialists who work in musculoskeletal and rehabilitation departments often emphasize that the simplest movements done regularly can reshape the way your body supports itself. And when adults after 50 learn this, the results are often surprising, because the biggest reason many people feel knee and back pain isn't damage, it's inactivity. Stiffness and poor activation of the stabilizing muscles that protect those areas. The truth is that your body is not failing you. Your joints aren't breaking down simply because you are getting older. What's happening is much simpler. The muscles that stabilize your knees and spine have become quiet. After years of sitting more, moving less, and relying on the same movement patterns, these muscles stop firing efficiently. Researchers who study neuromuscular aging have shown that inactive supporting muscles make the knees absorb more impact and the lower back take more load than they should. That's why one small movement, a movement that activates these stabilizers gently and safely, can feel like magic. But it's not magic. It's biology working exactly the way it was designed to. Right now, imagine your knee joint. It's supported by a series of muscles, the quadriceps, hamstrings, calves, and small stabilizers around the sides. When these muscles are inactive or tight, the knee feels unstable. The pressure increases. The soreness becomes an everyday companion. Now imagine your spine, another incredible structure that relies heavily on small muscles deep in your core and hips. When those muscles sleep, the spine has to work extra hard, creating that familiar lower back tension so many people experience after 50. Experts who teach physical reconditioning for older adults often emphasize that the first step to reducing pain is to reactivate the muscles that protect these two areas. And this is where the 5-minute move comes in, a move designed to wake up the lower body, reconnect the brain to the stabilizing muscles, and put your joints in a safer position before you begin your day. Imagine standing near a wall or chair for support. You shift your weight gently from one leg to the other, slow and controlled. It sounds too simple, but this small, deliberate shift activates muscles in your hips, thighs, ankles, and deep core muscles many adults haven't fully engaged in years. Specialists who work in senior gait and balance labs often use versions of this exercise to test how well the body responds to controlled weight shifting. And every time adults try it, something fascinating happens. Their legs begin to wake up, their balance improves, and their joints feel lighter. What surprises most people is how quickly the body responds. After 50, your muscles still have tremendous potential. Studies for American rehabilitation programs consistently show that older adults experience meaningful improvement in mobility from just a few minutes of structured activation each day. You don't need intensity. You don't need equipment. You don't need hours of training. You simply need to wake up the right muscles. Think of the body like a team. When the right members of the team are asleep, the wrong members have to work harder. That's when pain shows up. But when you gently reactivate the stabilizing muscles each morning, everything falls back into its natural alignment. The knees stop absorbing unnecessary weight. The spine stops carrying extra strain. The hips begin doing their job, and movement becomes easier. This is why professionals in mobility science keep repeating one thing: activation matters more than strength. Activation is what teaches the nervous system to support the joints correctly. Activation is what reduces pressure on the knees. Activation is what makes the back feel supported instead of strained. And here's the best part: this 5-minute move doesn't just help physically, it affects your confidence, your mood, your sense of control. When you step into the day feeling solid on your feet, when your knees feel capable, when your back feels supported, you start moving differently, you stand taller, you walk with more assurance, you feel more secure in your body. This move is not about replacing treatment or ignoring medical concerns. It's about giving your body the activation it naturally craves as you age. It's about taking your first steps of the day with strength instead of stiffness. And it's about realizing that you have more power over knee and back pain than you ever imagined. This is your first step. And in the next part, you'll understand exactly what this move does inside your body minute by minute, and why experts studying aging say it works so quickly. Now let's go deeper into what actually happens inside your body when you perform this simple 5-minute move. Many adults over 50 underestimate how powerful small, slow, controlled movements can be. But specialists in movement science repeatedly explain that the body responds instantly when the right muscles are activated in the right sequence. And this is exactly why this move feels so relieving for both the knees and the lower back. It restores a communication line that aging slowly weakens. To understand this, imagine the moment you start shifting your weight from one leg to the other. In that first second, something remarkable happens. Your stabilizer muscles fire. These are small muscles around your hips, inner thighs, outer thighs, and calves. Experts who research age-related mobility in American universities often describe these stabilizers as the silent protectors of the joints. They don't make you look strong on the outside, but they are the muscles that determine how your knees absorb force and how your spine stays aligned. When these stabilizers wake up, the entire lower body experiences a reset. Your knees receive better support, your hips open, your ankles become more responsive, and your lower back begins to decompress. This is why even adults who have been stiff for years notice improvement within days. You're not repairing the joints, you're reactivating the system that protects them. During the second minute of the movement, your circulation begins to increase in a noticeable wave. Blood travels down into the legs, carrying warmth and nutrients into areas that have been tight overnight. Mobility researchers studying older adults consistently highlight circulation as one of the most important factors in reducing joint discomfort. The reason morning pain is so common is because circulation is at its lowest when you wake up. Your muscles are dehydrated, your connective tissues are stiff, and your nerves fire slowly. But the moment you initiate gentle weight shifting, your blood vessels open, your muscles receive oxygen, and stiffness begins to break from the inside out. By minute 3, your hips start responding. And this is one of the biggest reasons this 5-minute exercise works so well. Specialists who work in senior movement labs repeatedly explain that hip weakness is one of the root causes of knee pain and lower back discomfort. When the hips are inactive, the knees compensate by absorbing extra force and the spine compensates by tightening. But when your hips wake up through controlled weight shifting, the load redistributes. Your knees are no longer crushed under pressure. Your lower back no longer has to lock up to stabilize your body. Your entire frame becomes balanced again. Minute 4 introduces something even more important: neuromuscular re-education. This may sound technical, but it simply means that your brain is relearning how to use your legs correctly. Experts in motor control explain that aging doesn't just affect the muscle. It affects the communication between the muscles and the brain. The connection becomes slower, weaker, and less precise. But when you perform slow, controlled movements, that connection begins to sharpen again. Your steps become more stable. Your balance improves. Your posture becomes more upright. All because your brain is relearning how to fire the muscles that protect your joints. By minute 5, something shifts emotionally as well. Many adults report a feeling of lightness, as if their legs are suddenly freer. Researchers studying senior wellness point out that movement doesn't just change the body, it changes the nervous system. It improves your mood, increases motivation, and reduces the sensation of pain. When your nerves fire correctly, Your brain interprets movement as safe instead of stressful. This is why once you finish this 5-minute move, your knees feel less pressured, your back feels less tight, and your whole body feels more awake. Now let's talk about the long-term effect. Specialists who teach mobility programs for older adults in reputable medical universities often highlight that activation is more important for pain relief than traditional strength training, especially for seniors. Strength is important, yes. But if the right muscles aren't firing first, strength alone won't protect your joints. Activation teaches the muscles around your knees and spine how to work as a team. And when your muscles work as a team, your joints stay safe. This is why this move works for so many people. It attacks the true source of the problem, not age, not inevitable decline, but the inactivity and poor muscle communication that silently develop over time. With every repetition of this movement, you are waking up the stabilizers that protect your knees, activating the deep core muscles that support your spine, increasing circulation that breaks morning stiffness, sharpening your balance, reteaching your nervous system how to move safely, and reducing pressure on your joints before your day even begins. Your body thrives on signals. When you give it the right signal first thing in the morning, it responds with strength instead of stiffness, confidence instead of pain, and mobility instead of hesitation. Every adult over 50 deserves to start their day feeling supported by their body. And this simple 5-minute move gives you exactly that, a chance to reset, rebalance, and regain the comfort you may have forgotten was possible. When you cross the age of 50, your body starts speaking in a different language, but most people never stop long enough to listen. The stiffness in your knees, that pulling sensation behind your thighs, the ache, that appears in your lower back every time you stand up. None of this is random. According to mobility specialists trained at leading rehabilitation schools in the United States, the human body adapts to how you treat it. And after 50, the adaptation becomes faster and more noticeable. If you sit longer, your joints respond with tightness. If you ignore your leg strength, your back begins to suffer. And if you stop moving, your muscles slowly switch off. But the positive side is even more powerful if you start introducing smart, science-backed moves into your daily routine. Your joints begin to unlock, your posture starts correcting itself, and your knees and back regain the support they have been craving for years. One reason why the simple 5-minute movement works so well is because it addresses something certified physical therapists call functional chain activation. They explain that the legs, hips, and lower back operate like a connected chain. When one link weakens, the others pick up more load, eventually causing pain. That is why so many men and women above 50 say their knees hurt when climbing stairs, but their MRI reports look normal, or they complain that their lower back aches even though they never had an injury. The issue isn't usually the joint itself. It is often the supporting muscles that have gone silent from years of underuse. Mobility departments at major American universities highlight that gentle daily activation exercises stimulate the neuromuscular pathway, waking up the glutes, hamstrings, inner thighs, and deep spinal muscles that are responsible for shock absorption and stability. Every time someone over 50 performs this simple routine, they send a signal to their brain that movement is still a priority. Research coming out of exercise science labs in the US shows that short, consistent mobility work improves the way muscles fire, especially in adults who spend long hours sitting. The researchers explain that long-term sitting is not just a posture problem, it changes how the hips and legs respond to motion. This causes the knees to take extra pressure while the lower back tries to compensate for what the hips are not doing. But therapists trained in clinical movement therapy repeatedly show that a few minutes of targeted mobility can switch this pattern back to normal. Imagine a 60-year-old man who hasn't stretched properly in 20 years. When he stands up from a chair, he presses on his thighs with his hands or he shifts his weight to one side. That isn't age, that is imbalance. Imagine a 55-year-old woman who used to walk gracefully, but now feels a pinch behind her knee every time she bends it. Again, this isn't age, it is tightness that has been ignored for so long that the body starts adjusting around it. Certified rehabilitation professionals explain that the human body creates compensation patterns to survive. But these patterns unknowingly steal strength from the muscles that should be working. When you bring the 5-minute mobility move into your day, you start reversing those compensation patterns. Your hips open, allowing the knees to move more naturally. Your spine straightens, reducing the load on the lower back. Your leg muscles activate, giving your body a sense of stability it hasn't felt in years. Studies from American kinesiology programs show that targeted lower body mobility increases blood flow to the joints, enhances synovial fluid production, and improves balance, which is one of the first abilities to decline after 50. Balance isn't just about not falling. It is about how confidently you move, how easily you shift your weight, and how stable you feel when you stand or walk. A powerful shift happens when people realize this. Pain is often a message, not a sentence. When certified strength and conditioning experts teach adults over 50, they repeat one universal truth: motion heals. Not extreme motion, not gym workouts, not heavy lifting, but intentional motion that tells your joints you are still needed, and your body responds instantly. The discomfort you feel in the beginning is not a warning to stop it. It's your muscles waking up, reconnecting, relearning, and realigning. Most older adults also carry emotional weight related to their physical pain. A man thinks twice before joining his family on a walk because he fears his back will tighten. A woman avoids stairs because her knees feel unstable. This emotional hesitation restricts their life far more than the physical limitation itself. But something incredible happens when the body starts cooperating again. As flexibility increases, confidence increases. As pain reduces, freedom returns. Certified movement educators often say that adults flourish when they realize they are not fragile. They are simply out of practice. This 5-minute move becomes more than physical relief. It becomes a daily reminder that you still have power over your body. You are not stuck. You are not declining. You are rebuilding. Strength after 50 is not about muscles. It's about momentum. Take one step, one motion, one small change, and your body will support you far more than you expect. What feels stiff today can feel effortless in a few weeks. What feels weak now can feel powerful again. Each day you practice this gentle activation, you are teaching your body a new truth: pain is temporary, but movement is transformational.